All right, we are ready. Welcome everybody to the Virtual Care Partners Training Module 3. Title of tonight's call and training is the Practice Standard Operating Procedures. And I am very excited particularly about this call because of our guest speaker, Robert Gammons, who is the CEO of Epic Movement. No relationship to the former Epic. Been in business for over 20 years. Rob has led hundreds of people and has hundreds of distributors bringing medical devices to healthcare professionals around the country. Okay, he's also a virtual care consultant with Virtual Care Partners and one of the #1 investors within the company. And his background is such that you're going to want to get a pen and paper. I'm going to pause here for a couple of seconds so you get a pen and paper, because the information you're going to receive tonight is going to be priceless. It's going to be priceless. And I remember meeting Rob at our first fly-in, and he came in and he saw the vision immediately. And now we are putting together systems and a lot of things behind the scenes that we're going to be bringing to all the Virtual Care Partners. But I reached out to him and said, listen, okay, I got a group of people that are hungry. They need to know how to go out there and really start to, seed and look for the physicians that are open to virtualizing their practice. So without further ado, guys, I'm going to turn this over, and I want to say thank you so much, Rob, for being able to do this for us. And you have a great group of people here that are dying for this information.
Awesome. Thanks, Jeff. Can you hear me okay?
Yeah, you're perfect, brother.
Awesome, guys. I really want to thank you for the opportunity to speak to you. I'm going to jump back in my slide to a little bit about me. My background was actually pre-med in college. When I graduated, I went into education and got a master's in education, and in a roundabout way found myself wanting to do and to own my own company and work for myself. And that led me to the medical field, where my current background in science allowed me to use that knowledge base to start some companies, and was very successful in starting what is called a DME company, which is Durable Medical Equipment, which we founded, and we were the largest independent provider in the Southeast United States. From that, we jumped into home health care, and I was the CEO and founder of that company. And from there, went into the corporate world with Encompass Home Health, which is the 5th largest home care provider in the United States. And then I went back to trying to take all these skills, wrap them up into a consulting business. And currently I do sales and compliance training for healthcare entities throughout the United States. And through some relationships within Cary, I was able to, as Jeff said, go to a fly-in meeting and hear about the vision, and was eager to plug my network of sales contacts into the platform and into what I think is going to be revolutionary within the healthcare experience. All that to say, I've spent about 20 years in sales, whether as a salesperson myself, leading a sales force, or running a sales and marketing within my companies. All of those 20 years were providing services directly to the physician. So it wasn't through insurance, it wasn't through third party, it was through knocking on doors and learning my way around and into a physician's office. So some of that knowledge and some of that experience is what I want to share with you all today. And I want to start by saying that I've seen some of the questions that this group has asked of Jeff and of the core group, and they are some amazing questions. And you, I can see that there's takeaway from these trainings. There is a general, thirst for knowledge on what are we going to do, how are we going to do it, when are we going to do it. And I can tell you that every one of those questions gets filtered back through me and back up into Cary, and then hopefully back out to you guys. So my goal today is to touch a little bit on that. There is a webinar later on about sales processes, and one later on about some compliance. And those are going to be must-sees if you're going to be successful within the physician office. You have to know what you're doing and why you're doing it and how to operate inside a doctor's office. It's a unique environment, one that if you haven't been around it or been in it, has a lot of nuances. And that's what I want to cover today. I want to go through some of those, share some of the knowledge base that I have or I've gained just through my experience and through working with reps throughout the country. So with that, I've titled this the do's and don'ts within an MD practice, or you can swap that out with a DO practice. But the do's and don'ts, what can you do, what can't you do when you're in an office, and what's going to get you the most bang for the time that you're in there. I'm going to lead through this. I'll get through as quickly as possible. I do hope that you can message some questions later on after the presentation, as you've been doing, and hopefully we can cover some of those in the FAQs that are currently being housed within the virtual care website or on Carrie's website. So my background is a lot in compliance, so I'm only going to touch briefly on this because I know it is a full training that's going to come out. I believe it's module 5 or 6 that is coming up here in the next few weeks. But the number one question you're going to get, and I've rolled this out to my own doctors, and so I've seen these questions fired back at me. So make sure that you educate that the Carrie technology is HIPAA compliant. We're going to talk about in our other training what HIPAA means, what it doesn't mean, some misconceptions about what it actually is. But for the sake of a general understanding, it's Health Information Protection Portability Act. It was actually given and a law that was passed to protect your information and give you the protection that no one's going to share your health record with anyone. So when your doctors ask, is the software compliant? Yes, it is compliant. You don't really need to go into more depth than that. It's in all the disclosures, but it is a question you're going to get probably right out the gate. With that said, don't ever make any requests for patient records or information. Sometimes those there's excitement built around what we're trying to do with Carrie. If a doctor says, hey, go, let me pull a patient census for you for my practice, don't take it. Don't ask for it. Stay away from any patient records or information. Any requests for that type of information will flow directly through Carrie through a compliant file sharing that we have the technology that allows us to do that. As an individual, you do not. So make sure that we toe that line. It is a hard and fast rule that we don't want to get into requesting or handling any of that information. Do make, and I already mentioned this, do make the future training on Stark anti-kickback, that series that's going to talk about compliance. These are federal laws that you need to know. The doctor's going to ask you about it because they're not going to understand how are you able to pay me as a physician for seeing a patient? And they're going to throw words like Stark and anti-kickback. I can tell you we're in full compliance with those. So if that question comes up, yes, we're in compliance with Stark. There is no kickback law, but you want to learn what those are specifically. We're going to cover those, like I said, in future trainings. But we are in compliance, and there is no violations within the Carrie platform for what we're doing with our software and for the patients. Do you know the difference between an MD and a DO? Sounds kind of silly, but it does come out. I've had people say, well, okay, what if the doctor's not an MD? What if they're a DO? They're both medical licensed practitioners. It's just a different schooling that they attended. So it's a doctor of osteopathic is a DO versus a medical doctor, which is MD. They both have the same prescription writing abilities. A DO is a little bit more holistic in their approach, but there's no distinction between them and the use of the Carry platform. At the current point, don't market the product to ARMPs or PAs at this point until we can credential them. We want to stick with the practitioner that is a doctor or is a DO. With that said, let's dive a little bit into the physician office hierarchy. When you walk into a physician, and I want to preface this by saying that, and as Jeff has said before, we are targeting warm leads right now. We are not asking you to cold call an office. There is going to be a sales training as one of the core certifications, and we may touch on the cold call. It may be an aspect that you're eager to do. I will tell you it's difficult. It's a process where my device reps, my farm reps have spent months and months training on how to perfect that cold call. At this point, we want you to go to your warm leads. And that warm lead probably at this point means that you have a connection with the physician who owns the practice. So what do I do once I have that? So I've talked to the doctor, whether it's through a network meeting, whether it's over dinner, whether it's from a personal friend, whether it's my own physician. That gets you in the door. But there is now a entire complex medical office that you're working in, and you need to begin to understand the role of key personnel within that office. Most of your offices are going to have what they're going to call a practice manager. There's going to be times where a doctor's probably just going to say, go talk to the practice manager. The practice manager is kind of like the CEO of the office. They run the day-to-day operations within the office, everything from billing to credentialing to scheduling to new products to supplies and everything in between. Sometimes they're the gatekeeper. They're the person that you have to get to understand exactly what we're offering to the practice. There's going to be a billing team in the office. They're going to ask, how do I bill this? Just reassure them you're not adding on a biller. You're not adding any work to them. It's an automated process. Know who they are, but know it's automated, and we're not adding work to you. Make sure that the MAs, that those are the medical assistants, are in the office. Make sure you know who they are and know that they're the first line of people that are going to be interacting with patients when they come into the office. There's the back office. I know Dr. Dan McDyer talked about how he incentivizes his entire staff to help build patient enrollment. In order to do that, you need to know who the people are and what their role is within the office. And it's okay to ask. I can tell you from doing this, the first thing I do in an office is I grab a business card, I flip it over to the back side, and I just start asking, what's your name and what do you do? It's simple. It's an easy question. It engages the person. They understand, they feel value. And you begin to build that rapport. The more people you interact with within the office, the more they trust you being there, the more successful you're going to be. Don't assume that the physician has the final word within a practice. I can tell you there are a number of practices where family members work within the doctor's office, whether it be the wife of the doctor, the husband of a doctor, the doctor's kids, mom, everyone in between. So while the doctor may love the platform and the idea of what we're selling, do know he may not be the only person you need to talk to. And that goes back to understanding the key personnel within the office. He may say yes and then send you down the road. In the same token, make sure when you're talking to someone that you have learned the relationship. If you happen to be talking to the wife of the physician, I can tell you she's equally as important as the doctor is in that practice. So make sure you learn who is in that office and make sure that you are communicating with the right people. Do make appointments to meet with the key personnel. Again, once you have that warm lead, it's okay to say, Dr. Smith has given the green light on this product. I'd love to sit down with the office manager. I'd love to sit down with the practice manager. Love to sit down with your administrator, depending how big the practice is, and set a time with them. This is not a short process where we're going to be able to implement in one visit. So, respect their time and make appointments, and they will make them for you. However, don't commit to doing a lunch until a physician agrees to use Carrie. What happens is, even, again, warm lead, doctor says yes, you walk in, now there's 6 people in this office, and you're supposed to talk to all of them, and the first thing they're going to tell you is, yes, we'd love to talk to you, but you got to schedule a lunch. And for those of you that haven't been in medical offices, that's fairly common, but I can tell you it gets really, really expensive. And the lunch is really not the venue for you to go and explain what Carrie is. So don't fall into that trap. Everybody loves a free lunch, but it's not where you want to go. Okay, you want to get a commitment by the physician to agree to Carrie. Let him set or help you set the next appointment. Once revenue starts coming in, sure, go ahead, bring them lunch. That's great. Bring them something, donuts, whatever they want. Thank you for getting on board with this. Don't lead with that. You'll be very disappointed on the outcome.
Hey, Rob, when they're making $3,000 a month from that practice, maybe we could buy them a donut, right?
That's right. Right. Just don't lead with that. Do recognize that time spent speaking to you is time away from their duties. I can tell you almost every practice, because medicine has become what it is today, unfortunately, it is a time constraint, and every office is understaffed. Every person in the office is overworked, including the physician himself, who now is seeing anywhere on average 25 to 30 visits a day. 6 people in waiting rooms, in the exam rooms, and another, 20 in the waiting room. Carrie's going to alleviate that. But until you get it implemented, recognize that when you do stop and chit chat and are beginning to learn those key personnel, be direct, be quick, ask your question, and move on. They have a job to do, and they're not doing that job when they're talking to you. So make sure that we don't sit down and have a full-on conversation with someone in an office for 15, 20 minutes. It's only going to lessen the impact of what you're trying to accomplish. You're there to do a job. They have a job. And let's be as efficient as we can. I can tell you, don't make an appearance on a Monday morning or a Friday afternoon. It is death in an office. Unless you have a solid prearranged meeting because they took the time off. Monday mornings are awful, and Friday afternoons are equally. So you want to make those appearances at a time where it is convenient, or at least not as hectic as those two things are going to be when you walk into an office. So let's talk about a little bit about your role in that office. And I try to make it as simple as I could here. Engage, connect, support. That's about as easy as I can make it. These are gears on a wheel. They all work together. One spins the next. Engage, connect, support. You got to engage the office and Carrie at all levels, which I just talked about. Everyone in the office needs to know what Carrie is. You need to know what they do, and they need to understand what Carrie is. So engage every person. They're all important. Everyone there touches a patient in one way, shape, or form. And so everyone needs to be talking the language about Carrie when the doctor decides they want to be part of this platform. Connect the physician to the revenue and the quality of medicine delivered. That's your hook. That's what you're getting in for. The platform is free, but in order for everyone to be successful in the model, we have to talk about the revenue. And I know in the VCP website, under the resources tab, there is a PDF that's great that goes through the revenue model. Have that readily available and understand it. Speak the language. And then second of all, the purpose of getting this revenue back to the physician is it allows him to get back to delivering the quality of medicine that he trained for. No doctor went in to become a doctor to treat a patient for 7 minutes in what we call a reactive type medicine, where I'm only seeing the patient because they're sick. And all I can address is their one individual concern. And in fact, insurances actually dictate that, where I can't walk into my physician and say, I've got 5 different problems. They're going to say, what's the most pressing? That's what we're going to address today. That is the insurance model driving how they can deliver that medicine. Putting revenue back to the physician is going to allow him to get back to delivering a quality of medicine that he really wants to do when he first got into medicine. And more important, when we start talking about the preferred provider and moving to a concierge type medicine, this becomes even more relevant, because now we can actually spend more time with our patients. We can be doing preventative medicine, and thereby driving down the overall cost of the healthcare model, which currently is so far out of line that it makes it really difficult to get in. Support the process and always be available via mobile or email. I can tell you, when you finally get the hook and you begin the implementation process, there's going to be a lot of questions. You need to be that support person. The more the doctor and the office rely on you for support, the more ingrained you become into the office. I know Dr. McDyer on his last call said, become a resource. Become a resource for the office. The only way to do that is to have this line of communication where you are always going to be available, whether it's via mobile, via email, but let them know they are not alone in the process. If those 3 things happens, your level of success within there is going to be really great. Office qualification. This is one of those things where it's important to know what you're walking into before you walk in there. And understanding the demographic of your office before you enter is hugely important. As we talk about concierge medicine and we talk about becoming a preferred provider, understand the demographic of that office before you approach the topic of what plan might be best for the office. If you have an office, for example, that is primarily Medicaid driven, if you have an office that is even primarily Medicare driven, those 2 demographics are not going to be the office you want to talk about concierge medicine. It's the same reason why we wouldn't put whatever your favorite shopping mall in certain areas that don't make sense to the population that is there. You want to be sensitive to the doctor. The platform works for everybody, but sell them what is best for their office. Concierge medicine is not going to be for every doctor. It's going to be for a lot, but not everyone. Be sensitive to that. Understand that you're trying to meet the needs of the practice where they're at. You're not trying to take them to a place where they can't go. Don't sell Carry as a standalone product. And I put this in here because it was a question that I got from one of my physicians that was like, well, once I'm on Carry, what about all my other patients? Well, All your other patients you still see them the same way. What we're saying to you is you're going to get a subset of patients, right? Our goal is, let's say, 10% of that entire physician's population. And go back to Jeff's comp plan and look at the conversion rate. We get 10%. We're doing a great job. So Carrie isn't a substitute to eliminate the doctor's practice. Carrie is an opportunity for them to take a section of their practice, generate revenue, lessen their work, but it doesn't change their practice. It is an add-on to their practice. Physicians get very touchy and they get very concerned when you start talking about, well, what if I can't see patients? What if I want to see a patient? What's going to happen? You see them. If you want to see your patient in the office, see them. But if it's more convenient for your patient to not come into your office, that's where Carrie works well. So it is not a standalone product, meaning Carrie's not going to take over the doctor's practice. That is not our goal. It shouldn't be your goal. If you get 100% adoption in an office, that'd be fantastic. But it doesn't negate the fact that that doctor still needs to see patients. Maybe he just doesn't have to see that many 5 days a week. But there is not going to be a substitute for that. That face-to-face contact visit is going to have to happen. It just could be less, and they can spend more time in those when there's not a waiting room full of people. Do recognize the workflow to utilize Carrie within the practice. And I know Dr. McDyer talked about this. We've all talked about this for a long time. There is workflow that's involved. So, I've thought about how to present this to the doctor. There are going to be employees of the physician that are going to have to increase their workflow. That is a fact. So please don't go and say that, oh, once it's installed, it works by itself. You don't have to do anything. Not true. Not true at all. Someone has to manage what we're calling the practice management screen within Carrie. When those appointment requests come in, those appointments are triaged in the software itself, and then they're assigned to the provider at a specific time. That does not happen automatically. So whoever the scheduler is in the office, who you hopefully at this point have learned their name and understand their job, yeah, this is going to require a little bit of extra work in order to make Carrie go around. So don't sell it as, once you install it, it's a piece of cake, it's easy, we just click a button and we FaceTime. Not true. And I can tell you, the more truthful, the more honest you are with a practice, the better your chances of integrating the product. Once you start making promises that you can't deliver on, or you start saying things that you're not sure if it's like quite the truth, but it sounds okay, you're going to sink. Remember, the level of people that you are communicating with the office is unlike most places where you're doing a sales call. Every medical person has spent, collectively, probably the office has at least a 4-year college education with almost every person that you're going to talk to in the practice. They're smart individuals. Don't try to get around something. If you don't know the answer, I'm going to say this later, don't give an answer. Don't expect immediate adoption. We've talked about this a little bit. It is going to take time. It is going to take work on your part. You can get there, but no one's going to start out the gate with, everyone in their practice signs up. It's not going to happen. You want to work through the kinks. You want to continue to push it, and don't be discouraged. I can tell you that doctors are slow to move. The offices are slow to change. But with your continued support, with your continued gentle prodding, hey, how are we doing? How are we moving along? That's where this is going to roll into a great adoption down the line. Some insurance legal questions that have come up. I've seen some of them on the core group discussions. I want to touch on a couple. of them. And these have also been shot to me from some of my physician friends. Do explain that carry is a cash pay model. It doesn't interfere with their existing contracts, and it is not billable. Meaning that a lot of doctors are going to say, well, if I do this, what about, is United going to get upset because I'm seeing patients through carry? Am I going to lose my Blue Cross and Blue Shield contract because I'm seeing patients through carry? No, no, and no. Because you're not billing it through the insurance. So there is no insurance component of this. This is a cash pay model. So there's no threat to their existing contracts related to the insurance. Can their patients have insurance? Absolutely. When they come into the office, are you going to do the same type of billing that you've done prior to carry? Yes. Yes, all that's going to happen. What we're saying is the carry visit is a cash pay model. When you go through the platform and you connect doctor to patient, the payment feature is already automated. There is no need to do anything except for see the patient through the platform and take care of the patient as you would as a doctor. They cannot bill this, just to be clear. You can't do both. So please make sure that they understand that. You will get that question. Well, even though I'm getting paid through carry, can I still bill their insurance? No, you cannot. I just said this a moment ago. Don't answer a question of which you do not know the answer. It's okay to say, let me get back to you. In fact, I would encourage you before you leave an office to leave with something that you need to research so you have a reason to go back. So don't ask a question what you don't know. It's okay to go back. Know your product, but you're going to get some crazy off the wall questions that are going to come up when you're in there with the physician. And probably he'll shoot it to you knowing that you don't know the answer, and that's okay. Come back with the right answer. Get with your upline person, get with myself, get with Jeff. We'll get you the right answer to go back to. Do reassure that carry and telemedicine is a recognized form of delivering care within all 50 states. It is. The doctors are going to say, well, I've read a lot about telemedicine. I really want to do it. I don't know if it's allowed. Yes, it's allowed. 100% is allowed. In all 50 states, absolutely you can do it. You can prescribe from a telemedicine visit. Actually, we've all seen the stats. 70% of the visits that you're doing, you probably should be doing through telemedicine. Absolutely is a recognized form. So please, by all means, go ahead and reassure them of that. This came up, and this is a question from me. It actually came from one of my physicians. I want to throw it out there. HSAs will not pay for this, so your patients cannot use their HSA accounts. Medicare is not going to reimburse it. For some reasons, doctors think Medicare and insurance are different things. So when they ask you a question about insurance, they don't always make the correlation that you're also talking about Medicare. Medicare, Medicaid, and insurance and a physician's office are two different monsters. So make sure that you understand that when you're talking about it. Specifically reference, you can't bill insurance and you can't bill Medicare. Sometimes it makes sense in your mind. Well, aren't they one and the same? Yes, but not in a physician practice. They are two very, very different groups. So Medicare, insurance, neither one of those are we going to bill. However, all those individuals can absolutely be part of carry. They cannot use their HSA account to pay for carry. That is going to actually come out in the FAQs on the carry website within the next few days with the legal opinion behind it. But at this point, HSA, I use acronyms a lot, and you'll find a lot in doctor's offices. They'll make your head spin. HSA is a health savings account. It's a form of medical insurance where you get a tax deduction taken out. It's tax-free money that you put in there to pay your medical bills, and it's called a health savings account. You cannot use it to pay for carry. Do explain that documentation and eScribe is available within carry. I have my doctor say, well, when I'm on the call with a patient and I'm talking to him, what do I do? Well, there's going to be a window pane on your computer, and you're going to document just like you do in your normal EMR. And what I've told my physicians, which I think is something that's important, that note that they're creating in Carrie is as easy as sending a PDF from Carrie into their EMR. It's the most effective way. So take the PDF note and drop it into the EMR. It's easy to understand. It's easy to do. And yes, they should absolutely have to do a documentation of the visit. I don't believe Carol actually let them close the visit until they've done some sort of documentation. And yes, they can prescribe through the platform for the patient's prescription. It goes right through the platform to the pharmacy, and you're able to go ahead and pick that up. All that happens through the...
Rob, yes, real quick, is FSA same as HSA, flexible savings accounts?
Yes. Okay. That's it. Yes, same thing.
Okay. Thank you.
Yep. Don't allow the MD to pass calls to anyone in the office. So if you get the question, I've already gotten this question from one of my doctors. Well, once my practice manager assigns me, can I start the call, and then can my MA or PA or some other person in the office triage the call? No. Remember that the telemedicine visit for the doctor is 7 to 10 minutes. There is no need to do any triage prior. The patient's already going to put the reason for the appointment, what their symptoms are, what they're feeling, how they're feeling, what they feel is, might be the underlying diagnosis. The doctor has your medical record. The doctor that is credentialed through Carrie and the doctor that you has signed the agreement to be the treating physician has to be the doctor that sees the patient. So, there's going to be end arounds. They're going to want to try to work the system. Well, I want to use my PAs. I want to utilize my nurse practitioners. I want to use my physician assistants. I want to use my residents. I want to use my... No. Doc, it's got to be you. You're the one that's getting paid to do the visit. You have to perform the visit. I think it's pretty self-explanatory, but don't be surprised when those questions come up.
Hey, Rob, this is for me now, because I want to have an understanding of this, because I want to make sure I'm letting my people know the right answer. If I'm a doctor and I have a PA, can I assign the PA to take the calls and I'm not involved?
I think the answer to that is in the credentialing process. To my knowledge, I'm not aware that we're yet credentialing anyone but physicians. Now, I don't know if that allows them to credential their license and the people underneath them. I do think I think that potential exists. I think that that is something that we have to get a better answer to, and from Carrie itself. But I do know at this point, we're only credentialing the doctor that signs up. So now, if the doctor and the PA and the nurse practitioner all go through the sign-up process within Carrie and go through HealthShare, some of you may have clicked on this. When you go to the virtualcarepartners.com website, I had one of my VCCs actually click, instead of becoming a consultant, it says they click to become a provider. So there's two links on the website. The consultant is the VCC sign-in. When you click become a provider, there is a whole list of questions that the physician has to go through and answer all those questions. I feel like those questions I feel like those questions are geared more towards the medical physician, not the PA and nurse practitioner. But it doesn't mean that they can't get credentialed underneath them. So that's a question I will take back to Carrie and get a better understanding of. But I will say that to my knowledge, you can't have a person that's not credentialed taking that call.
Okay.
That's
And
my baseline.
this is an important point. So maybe this is one we tell the team we have to get back to, because I'll just tell everybody, I've said if a doctor's not available, he could pass it to a PA. So I want to make sure that we get this answered right away. And I could see the chat line now lighten up. Clarification around mid-levels is key from Sonia,
Yep.
one of our core group members.
Mid-levels being the PAs and such in the office, correct?
I'll wait for her to respond. Yes.
Okay. Yeah.
We were told by Dr. Dan that we could. So we got to clarify this. So I know this is a big one. I knew when you said that this was going to get some questions. So let's get that clear.
Yeah, and I do know when Dr. Dan was talking about that, I think the devil in the detail is in the credentialing.
Okay.
So if you're able to credential everyone in your office, then absolutely, I wouldn't see a problem. If only the doctor is credentialed, there is somewhat of an issue there, because Carrie's legal protection, I think, is a little bit diminished if we're not credentialing all the people, because they're all licensed practitioners. So the credentialing process is able to be done on everyone that is within the office. But I think that has to happen before we can assume that someone other than the original prescriber can take that call. But
Okay.
we'll circle back to that, and I think we need to post that on the website as soon as we get an answer.
Okay, so hang tight, everybody, on that question. I know it's a big one, and we will get back to you very quickly on that.
Yep. Yeah, my assumption on that was not to start a large discussion. It was more along the lines of, you got to be credentialed. So whoever's credentialed has got to take the call. If we're going to credential ARNPs and nurse practitioners and physician assistants, that's all great. I just don't believe you can pass a call to someone that's not credentialed.
Gotcha.
Okay. Tips of the trade. Before I get to those, I just want to give a reminder about the value of a preferred provider. So I kind of threw this in here at the ninth hour here of slides. We've been talking about the preferred provider, and there's a PDF in the resources about the benefits of the preferred provider. And there's a component of the preferred provider that I don't think we have adequately put out there yet. In order for Carrie to be successful, in order for you as a VCC to be successful, you have to have patient enrollment. Yes, there's money in memberships. Yes, there's money in selling it individually to patients. But if you truly want to get a sustainable revenue every month, you want to get patient engagement. And the preferred provider, one of the benefits of that is Carrie is doing the marketing, and we've talked about, we're going to do all the Google ads, we're going to do social media for the doctor, we're going to engage his practice, all those things. The bottom line of what we're saying is, if I'm selling preferred provider to the doctor, I'm telling the doctor, listen, doc, there's two ways to do this. One, you sign up, you enroll, and you do everything that Dr. Dan McDyer said. You incentivize your staff. Maybe you get your staff memberships. You take the phone calls and say, hey, do you want a virtual visit or do you want to come into the office? And you can go through that process. You're going to get patient engagement. But that is, we're going to send out, an email blast. I can tell you that, I get an email blasts all the time. We're going to send one a month. May it trigger some patient engagement? I hope. But the preferred provider, what it's going to do is it's going to say, option one is what I just said. Option two, doc, is we do the work. If you're a preferred provider, it's now our job to help convert your practice to the Carry network. It's our job to engage your patients. It's our job to provide you the resources. It's our job to launch your social media. It's our job to get you on FaceTime, on LinkedIn. It's our job to drive patients to your practice. So in order to do this, Doc, how much is your time worth? If you become a preferred provider, is it worth $1,000 a month? You make $100 an hour, $200 an hour, whatever the number is it worth $1,000 for us to do this work, to put money back into your pocket? My answer to that is going to be yes, all day long. We'll do the work for you if you're a preferred provider. If you're not, that's fine. No pressure, Doc. The platform's yours. It's free. Go ahead and use it. But you're going to have to get the conversion yourself. I'll support you. I'll help you as much as I can, but I can't sit in your office all day, every day and sign up patients. Can't do that. But your staff is more than welcome to do that. Preferred provider allows us as Carry to take the money you're paying, and it's a dollar for dollar. What they give us, we turn around and put back into the practice to help drive patient enrollment. Doesn't mean any of the other things change. Nothing else changes. But I think it's an important point when the doctor says, why do I want to be a preferred provider? Well, you get on our map. Yes. We're going to send patients to your practice that sign up for Carry. Yes. But we're also going to convert your patients. And if there's ever a doubt on how it's going to happen, and doctors say, well, I don't know how to do that. Okay, great. It's going to cost you $1,000 a month. It's cheap. It's cheap, and we'll do it for you. So that's something that we make sure that we are discussing as the difference in the two ways that Carry can launch in your office.
And Rob, I've heard this from Dan. Physicians understand $9.99 is cheap compared to what they spend their money on right now. It really is cheap. So don't be afraid of that. Correct?
Yes. Yes. I mean, $1,000 a month. I can tell you, what my cousin just launched. He just graduated from med school, and he's a physician here in the Orlando area, and he's launching his practice, and we worked on his budget together, and we went through the what it's going to be like as a new doctor in the area, and he's budgeting $10,000 in media to start his practice, and that's the minimum.
It's $10,000 for how long?
That might last a couple months. I mean, it's the bare minimum. It's the bare minimum to launch him onto a social media platform. Because of the volume we're hoping to do, we believe that we're able to do it at this price. But that doesn't scare the doctors away. I can tell you their telephone bill is probably $3,000 a month if you want a reference point.
Right. And it's a good point to make, everybody, that this is a group advertising co-op. That's why we have the spending power to do this. Their $9.99 goes way beyond $1,000. So
correct. And I will tell you, again, we're in the pre-launch, so that price point may change down the road. So there is somewhat of an incentive for a doctor to say, yeah, I want to get on that before the price changes. So just remember that as you're talking and you're selling this out there. A couple other tips of the trade here. Ask questions of the provider. Make sure that you know what their concerns are, and that you alleviate them as quickly as you can. I would say when we do the sales training webinar, make sure you attend that. I know Jeff has been doing a Success Zone, and those have been some really great, useful sales techniques that you're going to have to employ when you're in the office. But most importantly, like I said earlier, ask a question. If you don't know the answer, or they give you a question, come back. That's your reason to come back. Never leave until you have a reason to come back. dress the part. I know we're talking about, having some, I believe we're still doing some VCC scrubs eventually that are going to be part of the store. Dress the part. If it's not that, dress the part. You're entering a professional environment, so dress the part and learn your product. Understand what carry is and what carry is not. And don't over deliver, don't undersell, but know what you're selling, know what it does. And again, I said earlier, focus on the revenue, because that's the part that is going to ultimately take the physician from what he's doing into another level of service that he's not going to be able to do. And I can tell you right now, I literally have, I'm looking on my phone right now. I've got 2 doctors that are texting me right now. And one of them is an OB here in Orlando, and she's telling me about their current EMRs are all launching Hilo and eClinical are all launching this new telehealth as part of their platform. And she just texted me, I thought it was free, but now I see it's $2 per visit that I have to pay to use the software. And then there's also a monthly charge. So you're going to get it. The doctors are going to tell you, well, my EMR allows me to do this. Yeah, doc, it does, but you're going to pay for it. And I can guarantee you, even if it's free today, it's not going to be free tomorrow. In some way or shape or form, you're going to pay for that service just like you pay for your EMR. And there's no added revenue to using it. If you use eClinicals and you go ahead and see that patient, doc, you still can't bill for it because no insurances are reimbursing for it. Don't be misled. It's not doing anything but actually making you more work and having you do more visits for free, right? What Carrie allows you to do is now, anytime you have a call, and my friend that's an OB was just telling me, she's like, this is great. I get calls all the time from the women that are pregnant. Hey, this is happening. That is happening. Is that normal? She's like, I'm on the phone all the time answering these questions, and I don't get paid for it. She's like, this is exactly what we need. It's why Dan McDyer has been so successful. He's now capturing revenue that he wasn't able to capture before. So understand that our platform is a standalone from their EMR. Yes, use your EMR. You have to use it. Carrie stands alone. You can take your notes from one to the other, but the difference is Carrie drives revenue to your practice. Don't forget that. Learn what Carrie can do. Carrie's not part of their EMR. EMR is electronic medical record. It's another acronym we all throw out there. And there's tons of them out there, and you're going to hear them all: eClinical, Practice Fusion, on and on and on. Carrie stands alone, and it will always stand alone. And it's always going to be better than that because it's free. It's never going to change. It's always going to be free. And your EMR is going to charge you, and you don't make any revenue on it. So dress the part, learn your product. At some point, you need to learn how to describe Carrie in 3 minutes or less. If you walk in a practice, even if it's a warm lead, the first person you may encounter, that might be, and I'm not saying this is the doctor, it could be the MA, it could be the phlebotomist, it could be the front desk girl, whoever it is, you're gonna say, hey, what's Carrie? You got to have it in 3 minutes or less. So your elevator speech that you sell yourself, you got to sell your product. Do the same in 3 minutes. Practice on it. Stand in front of a mirror, give yourself a 3-minute speech. Can I describe what Carrie is in 3 minutes? Let's hope. Hey,
Rob, can you give him a tip right now on that?
Who, you want a 3-minute speak? Quick one?
It doesn't have to be 3 minutes. Just give them a tip. I know they're jonesing for. I could see them saying, please give me something right now.
I think what I would say if I was describing Carrie as quick as possible, I say Carrie's an opportunity for a physician to capture revenue that they're otherwise losing to outside entities such as your urgent care centers, your ERs, your CVS, your Walgreens, your Walmart, everywhere else that your patient's going because they can't see you and they want to see you. So here's the solution. You can see your patient, they can see you. It's convenient, and it drives revenue back to your practice that you otherwise don't know that you're losing. It's a HIPAA compliant telemedicine platform, and we're giving it to you for free.
Wow.
1 minute.
Bang. This has been recorded, guys. Go back. That was textbook. That was awesome.
And I've said this throughout the presentation, never leave without a next follow-up meeting. I know Jeff has said this in his Success Zone cast as well. You want to have a reason to come back. Come back, come back, come back. You know you're coming back. So it's, hey, Mary Sue, did I answer all your questions? So-and-so had a question I'm going to get back to. You know, or next time I'm coming, I'm going to bring that trifold. The next time I'm going to bring you our insurance, our map of our, whatever it is. You know, I'm coming the next time and I'm bringing it, and don't leave without that next meeting set, and learn the names of them. I can tell you, they're all professionals. Everyone in that office is a professional. They don't want to be called, hey babe, how are you? It's, hey Mary, hey Miss Sue, hey Nurse Joan. Learn their names. It's important. You don't think it is. It's one of those little things that goes a long way within the office. When you walk in and you can name off 5 people in the office as you come in, they feel like you're now part of their team, right? You've got a name, you know their name, we're all together, we're all working towards helping our patients. Learn their names. And last, be organized. It's a simple thing, but again, time is money to them and to you. So when you're out there, you know, don't walk in and be organized. Know what you want to say, who you want to talk to, have your information readily available. You know, if you can bring if you have a tablet and you can bring it, I can tell you that this, I saw this in my sales team so many times. A lot of the sales, pharma, med device people out there, they all have tablets. And I can't tell you the number of times we get in front of a doctor, we flip open their tablet, they have no idea what comes up on the screen. They have no idea what was the last thing they looked at. And we sit there and we spend 3 minutes that we just had with the doctor trying to type in a website that doesn't come up, trying to show them something on the screen, and it's not available, it's not working, and you've just lost your prime opportunity. So if you're going to go on with a tablet and you want to show them carry.com, have carry.com already open in your browser. So when you open it, it's the first thing there. If you want to show them how to sign up, have the virtual care website already up and ready. So you can say, here it is, doc, and we can go from that point. Don't walk in and I got to power on my computer and, oh yeah, I forgot it's got to run through 10 Windows updates before you can open the browser. Worst thing I tell you, swear to you, I've seen it over and over again, and you automatically fail before you even start. So make sure you're organized, know what you want to say, know when you want to say it.
Great tip. Great tip.
That's what I got today, folks.
Hey guys.
I appreciate it this time.
Rob, I want to thank you. That was awesome. I am so excited. I know our team is. And guys, listen, I know love goes a long way. Get on your chat right now, and I want everybody to say thank you. We want you back, brother. We want you back.
Hey,
okay?
Absolutely.
So watch the chat line blow up, and I want you to look, because these guys appreciate. We have a sales force that's going to blow up Carrie, and what you just gave us was something that was invaluable. Thank you so much. I really appreciate it. Thank you, guys. Look at the chat. Rob, just go to your chat, please.
I just did.
All right, good. It's
great people.
It's going nuts. All right, there's your love from Virtual Care Partners, brother. Thank you.
Thanks, everybody.
Thank you, guys. Bye-bye.